Hi there, this is Dr. Michael K. from the Center for Functional Health, and today we're going to discuss how certain foods can produce bad breath. Now, we all know they can, but how do they do this? So, bad breath is known as chronic halitosis or halitosis. So, there are some foods that cause bad breath temporarily, and you're familiar with them: garlic, onions, and spicy food. They're the common culprits. But how do they do that? Well, these foods are particularly high in sulfur. And the bacteria in your saliva likes to break the sulfur molecules down, and this releases what we call volatile sulfur compounds when you chew. It's a mouthful. So no longer bound to food, these volatile sulfur compounds turn into gas. This gas leaves your mouth on your breath. So substances like tobacco, coffee, and alcohol, they also produce odors with this foul smelling trick. Without any action on your part, these volatile sulfur compounds, they stick around for a few hours, sometimes causing excruciating misery to your friends, your family, your coworkers, and even to yourself, especially nowadays since we're wearing masks. So let's dig a bit deeper into chronic halitosis. So I already shared that certain foods may be the cause of transient bad breath. And in some cases, however, this bad breath, known as halitosis, may indicate a larger problem. So let's talk about imbalanced bacteria in your mouth. We're going to talk about oral hygiene. Our mouths are a rich source of microbes and bacteria. Some are more likely than others to cause bad breath. We have what's called gram-negative bacteria. Now, this is common with tooth decay and gum disease, and they're the most notable offenders. Now, while these bad bacteria can often contribute to bad breath, there's no single bacterial species to actually blame. Rather, it comes down to a complex of interactions of multiple oral bacterial species. And these interactions often occur on your tongue or deep in the creases between your teeth and below the gum line. You see, when there's an imbalanced amount of bacteria, volatile sulfur compounds, diamines, and short-chain fatty acids are produced in large quantities. Now, these smelly compounds, they mix with air in your mouth and they give rise to bad breath. Again, bad breath is known as halitosis and has many causes, and some of them are relatively easy to correct, while others you have to take a little bit more serious. An imbalance in oral bacteria may reflect imbalances in your diet and in your gastrointestinal tract. So let's talk a little bit about gum disease, as that may be an underlying reason for your bad breath. Again, bacteria thrives in the depths of our gum line. Some of these bacteria can actually cause gum disease. And diseases of the gums, such as pericoronitis or periodontal abscess, can increase the volume of those smelly volatile sulfur compounds or diamines in your breath. Now, diamines are two byproducts of ammonia and they're linked together. These are often to blame for a bad odor. Now, as we dive deeper under the gums, we actually see less oxygen and a lower pH. This acidic pH is ideal when it comes to creating those smelly diamines. In gum disease, deep pockets are created in the gum lines. Now, these pockets actually trap the food, allowing regular amino acids converted into diamines. Then when this happens, and those close to us, they start to smell the differences in our breath. So as you've learned, gum disease can be a major contributor to bad breath. It's important to brush and floss on a daily basis, and I invite you to also consider a water pick. Managing bad breath is more than just taking a few minutes. You need to consider a periodontal exam to actually assess your gums, and keep in mind that your gut, the way you digest your food, plays a role in bad breath. So I hope you got something from this presentation. Thanks for watching. This is Dr. Michael K. from the Center for Functional Health, and we'll see you soon.